Approach to brain tumor. The first thing will be clinical assessment. The symptoms of brain tumor could be sudden onset headache, which is because of raised intracranial pressure, new onset of seizure, focal neurological deficits, that is FND. So these are the symptoms of brain tumor: sudden onset headache, signs of raised intracranial pressure, new onset seizures, and focal neurological deficits. These symptoms will be insidious in case of primary brain tumor, and these symptoms are sudden in case of secondary brain tumor when there is metastasis. So the symptoms are sudden onset headache, signs of raised ICP will be there, new onset seizures, and focal neurological deficits. If it is a primary brain tumor, the symptoms will be insidious, it will be slow, and if it is a secondary brain tumor, the symptoms will be very fast, it will be sudden. A thorough history is taken, and then clinical examinations are done. See, MRI is preferred over CT scan. Certain imaging techniques are used like MRIs. MRIs are preferred over CT scan. Then if brain tumor is diagnosed, the management will have a multidisciplinary approach. In case of primary tumor, surgical resection, chemotherapy, and radiotherapy can be done. So for primary tumors, surgical resection, chemotherapy, and radiotherapy are the management. But if it is an advanced tumor or if it is a metastasis, then palliative therapy is used. Palliative therapy is for advanced tumors and for secondary tumors. See, palliative therapy का मतलब होता है to relieve the symptoms and to improve the quality of life of the patient. Palliative therapy का aim is not to cure the disease. The aim of palliative therapy is to relieve the symptoms and elevate the quality of life of the patient by psychological support or emotional support. So management, multidisciplinary approach. ठीक है. In case of primary brain tumor, surgical resection, chemotherapy, and radiotherapy. And for advanced brain tumors or metastasis, palliative therapy is done. Then the brain tumors are classified into primary and secondary on the basis of origin. Primary tumor are classified into glial, neuronal, and medulloblastoma. Glial tumors are classified into astrocytoma, oligodendroglioma, and ependymoma. Glial cells are classified into these tumors on the basis of the glial cells from which they origin. Then medulloblastoma, it is a primary embryonal tumor. It is the most common malignant tumor in case of children. The secondary brain tumors, they can metastasis from other malignant tumors like lung, breast, and melanoma, which is a skin cancer. Then meningioma, it is the most common primary tumor of the brain. Other primary intraparenchymal tumors of brain are hemangioblastoma, primary CNS lymphoma, and germ cell tumor. Hemangioblastoma, it is a very vascularized tumor of the CNS. Okay, it is associated with von Hippel-Lindau syndrome. Hemangioblastoma, it is associated with von Hippel-Lindau syndrome. Primary CNS lymphoma, it is associated with non-Hodgkin lymphoma. It can be a component of the disseminated non-Hodgkin lymphoma. And germ cell tumor, the most common primary CNS germ cell tumor is germinoma. Okay, so example of primary intraparenchymal tumors are hemangioblastoma, primary CNS lymphoma, and germ cell tumor. Hemangioblastoma is associated with von Hippel-Lindau syndrome. Primary CNS lymphoma, it can be a component of the disseminated non-Hodgkin's lymphoma. And the most common germ cell tumor is germinoma. Germinoma, it is the CNS counterpart of testicular seminoma and ovarian dysgerminoma. So the most common primary CNS germ cell tumor is germinoma.